Okay, nice to meet you. So the first, I want to introduce myself. I'm Zilu, and you can call me Aurora. I'm the postdoc in NIH, and I want you to introduce yourself.
Sure.
Yeah.
My name is Henry Colburn Stevenson Perez, and my nickname is Steve because everyone remembers me.
Yeah.
My patients call me Steve. Everybody calls me Steve. And I'm a physician at Walter Reed. And I'm specialized in cancer immunotherapy using the immune system to treat advanced cancer. I do want to make one other key idea before Ananya introduces herself, and that is that we are looking forward to the conference on April the 1st.
Yeah, April 1st.
The SAPA conference.
Yeah.
And yet we will all be appearing as private individuals. We will not be representing the federal government or Walter Reed or anything like that.
Oh, okay, I
So
see.
everything you'll hear is just me speaking for me.
It's our personal opinions. It's
Oh,
not
okay,
the
yeah.
shared agenda of any federal agency.
Yeah, I know it's government policy, right?
Yes.
My name is Ananya Malcha. I am a research intern at the Cancer Immunotherapy Unit at Walter Reed Hospital
Yeah.
since for about 2 years now. And I'm very,
okay.
very grateful to be here.
Okay. So what about Mark?
Yes, Mark.
Hi.
I'm Mark Wilhelmi. I am a patient of Dr. Stephen Perez. I contacted melanoma in 2014, and he has been taking care of me ever since. And we have developed a relationship in which we are pursuing the increase in my immune system's ability to fight cancer.
Okay, so we can see it's a very special team. You are a physician, and she is a researcher, and he is a patient.
And
So,
we
yeah.
could not bring all of our patients here today,
Yeah.
but we'll bring many, many more with us to the conference on April 1st. We could not bring all of our researchers here today,
Okay.
but we'll bring many more on
Yeah.
April 1st. And we could not bring all of our clinicians, but I'm here doing
Yeah,
the best.
yeah, okay.
The other fourth group that we are working closely with in this new seminar, the Rethinking the Science of Cancer, are caregivers, people who take care of people with cancer.
Yeah.
They also know a lot that we need to learn from, and we're learning a lot from them.
Okay.
And as we talk today about Matthew, the director of this center, I think increasingly the fifth group that needs to be really an intimate part of this conversation are the people in business, people who really want to start businesses in biomedicine that have a focus on cancer. I think they have so much to offer.
You have so many patients. Why choose Mark? So he must be very special.
Well, Mark is very special. There's no doubt about it.
Yeah.
At the same time, I would have to share with you, I'll try to be as simple as possible.
Yeah.
When you're thinking about cancer therapy, we talk about, our team works mainly with solid tumors, not with leukemia, not with hematologic malignancies, but with the solid growth tumors. And melanoma is a perfect example of that. And then our team does not work with radiation therapy of this.
Yeah.
We don't work with chemotherapy or targeted therapies. We work with boosting the immune system of these cancer patients.
So it's immunotherapy.
Immunotherapy only.
Okay. Yeah.
And as we'll be talking a lot, certainly on April 1st, every person's immune system is completely different. Your immune system is very different than mine. It's protecting a very different part of space than mine. And we cannot use a one-size-fits-all sort of approach. We have to start thinking as researchers in new ways to learn directly from each unique experiment. Each experiment is unique. And Mark is aware of this. And we'll be getting in detail on April the 1st from the patients themselves how not only are they learning how to master the science of immunotherapy and cancer, but also to really be co-creators and collaborators in the research experiments. They realize that each of their lives is an experiment in itself, and now they're learning how to co-design. So Mark is very gifted at that. But I would say we have now maybe 30 or 40 patients like Mark that have really woken up to the unique opportunity they have to make a big difference, not only in their own lives. Well, I tell each patient, you make a brilliant move for you. That's all you have to do to save your own life. But in doing so, you're going to teach all of us so much.
Okay, so patients give a lot of contributions to your research.
Absolutely.
I think. Yeah.
Yes, they are actually the ones who are driving it forward largely. As we mentioned before, we work with several different groups, clinicians, researchers, patients, caregivers, and now we really want to also reach out to business leaders.
So could you tell me something specific about immunotherapy? Because I know that it's CAR T and PD-L1 blockage. It's very famous right now, right?
It is. CAR T cells and the so-called chimeric antigen receptors.
Yeah.
And then PD-1.
Yeah, PD-1
which stands,
is very...
and it's actually anti-PD-1. And this is so anti-programmed cell death type 1.
Yeah.
And in just saying these words that I just said, they don't make any sense. It gets very confusing. And in fact, the specialized language that describes the human immune system probably has in excess of 100,000 words right now just to describe that. And we just mentioned two of them, CAR and PD-1. So the question becomes, how do young researchers or how do patients who are just jumping into this start to make sense? And this is where Ananya and her colleagues came up with this radical idea about a year and a half ago because they wondered, how would I know that I'm making a brilliant choice in my cancer research? How do I know which of all of this stuff I should focus my life on? And of course, for a patient, that's what they're trying to figure out too. Should I be doing CAR cells? Should I be doing, like Dr. Rosenberg at the NIH has his activated TIL cells? Should I be doing interleukin-2? Should I be doing IPI? Should I be doing anti-PD-L1? There's so many options. How do I figure this out? And so they created a tool set that allows them to start to really master how the immune system works from the outside in. That is the purpose of the seminar on April the 1st, so that everybody starts to master these basic tools that allow them to understand how is the immune system working, not only to fight cancer in cancer patients, but this idea that's growing so fast that everybody has cancer all the time. I believe with all my heart that I have melanoma right now. That I do. I believe you do too. Yes. And then the question is,
I hope not.
well, I believe you do. And then the question is, why don't you have melanoma? Why are you not a patient? And the question, I think the answer is increasingly become because your immune system is recognizing these transformations at the very earliest levels and eliminating it. And the ultimate purpose of this entire series that we want to take across the nation, this conversation, is to help understand what research do we need to do so that everybody can be free from cancer, because we now understand how the immune system works, not only in cancer patients like Mark, but in all of us.
Okay. So now I want Mark to talk about his feeling about this treatment, all this research.
I was given a choice when I was told that I had melanoma. I was given a choice of taking interferon injections for a year or trying a new drug called ipilimumab. And I would only have to have 3 sessions with ipilimumab, and I wouldn't have to inject myself. So
4. You had 4.
4?
Yes. They were 3 weeks apart. There was a total of 4.
I lost count. But anyway, I had 4 injections of ipilimumab, and I decided to go with that because I figured it was probably better than interferon because it works with my immune system. And obviously it worked because I don't have any detectable melanoma right now. But the problem with it was the side effects. My endocrine system shut down, my pituitary gland, and so on and so forth almost stopped completely. But fortunately, I got to an endocrinologist, and they helped me bring it back, including my adrenal gland and thyroid. The other side effects I've had with it are my skin had a rash on it for a while. I still have a little bit of arthritis in my hands and in my back. But I'm really grateful that I was given the opportunity to have that drug, and actually looks like it has gotten rid of my cancer.
So the challenge has been for every patient, they learn this at the very first hello. We believe that their immune system is watching that cancer all the time, like a spy looking at another spy, back and forth like that.
Yeah.
And we want to give their immune system the upper hand so they know more.
Yeah.
And there's a class of drugs called checkpoint inhibitors that take the brakes off of the immune system, the normal brakes that keep us from having autoimmune disease. And when we take these off, many times they can now detect and eliminate the cancer. The challenge is we don't know how to give them these agents intelligently yet. We know that the immune system is very complicated. We know it has lots of moving parts. We know these immune system cells talk to each other a lot.
Yeah,
For example, in the crosstalk.
Yeah.
We know in the conference on April 1st, we're going to learn about interleukin 10, for example, one of the many cytokines that they use. And we're just giving one of these agents, these checkpoint inhibitors, at massive doses. And we do it for all patients the same. And we know that's wrong. But we're trying to learn to be smart very quickly.
Yeah.
The side effects that Mark has described are very common, where suddenly T cells start attacking normal self. Skin, he described, joints, arthritis, he described, and your endocrine system, starting from the pituitary to all of your glands, thyroid, etc. And so now the patient has to be doubly prepared. They have to know a lot about cancer. They have to know a lot about fighting cancer with the immune system. And then they have to be prepared for the immune system fighting themselves. And how do they recognize the side effects, and how do they recognize? And this can be lifelong. So this isn't a little something that happens. This is a lifelong battle. Mark is typical, I would say, in his ability to really think this through. And we have a great team at Walter Reed. We have lots of different clinicians that work really well together. Surgeons. He didn't mention another complication he has from the surgery. When we removed his lymph nodes, I guess it's in this arm, he has a condition known as lymphedema, which is a swelling of his arm. It's very common with these surgeries. And so that's just another complication. So we have surgeons, radiation therapists, radiologists, interventional radiologists, pathologists, dermatologists, medical oncologists, physical therapy people, endocrinologists, rheumatologists, and he's met almost every one of them. And we work as a team to figure out exactly what each patient is going through and what support they need. Mark, I haven't talked to you for a while, but my sense is that you have really, on your own, figured out how to get past many of these side effects, such as the lymphedema and the endocrine dysfunction. Is that true?
Yes. I went online and studied the immune system, or the lymphatic system that's part of the immune system, and I figured out some exercises that I could do that might move the lymph fluid out of my arm. And so far it's been successful. If you can see, this is my normal arm. I didn't have surgery on this side of my body, but I had surgery here. Originally, when I had lymphedema, this was all swollen here. You couldn't see the bones or anything, or any of the sinews or anything in my arm. But now that I have come up with this exercise and stretching, I do stretch my armpit and everything to try to minimize the problem with the scarring that occurred after I had the surgery. It seems to have improved my arm. I still wear a compression sleeve on my arm at night at times, but I don't wear it faithfully like I used to have to before I started doing these exercises and started my own experiment on how to try to fix this lymphedema.
Are you still taking replacement steroids? Any hormones anymore?
I'm just taking Synthroid right now.
Okay.
But I hope I'm going to be able to drop that. I feel really good. I've been exercising. I'm going to physical therapy down here from my shoulder because I hurt my rotator cuff, coincidentally on the same arm, and they've also been stretching out my arm also to get rid of the cording that occurs after I had, or that will occur after you have surgery. That's been, to me, it's been helpful and gives me a better outlook on life, more positive. I thought when I first got this lymphedema that I'd never be able to get rid of it, but I told myself that I wasn't going to let that get me down, that I was going to try to figure out how to get around it or how to fix it. And I hope to pass what I've learned on to other patients.
And not only just to patients, he's been actually teaching our staff as
Oh.
well. So in the
Okay.
past, we've always had something called patient support groups. Where
Yeah.
patients get together, they talk, it's about coping and that kind of emotional response. But the science of it, they don't necessarily get involved in. Our patients really get involved in the science. This idea
Yeah.
of making lymphedema go away, we've never seen that before. And so he's actually teaching our staff how he figured this out.
And I want to echo on what Steve and Mark just said about patients creating their own experiments to get better, because we really believe that every patient has a unique immune system, and
Yes.
every patient comes down with a different problem. Like if your car breaks down and if you go to get it fixed, you're always not going to have a carburetor problem. Just like that, everybody has a different kind of problem with their immune system, and their immune system is really, really unique. So the patient, for the patients to be able to design their own experiments and actually be successful in them is one of the goals of our Rethinking the Science of Cancer seminar series. And we think that it's turning out to be really, really successful. Like Steve was mentioning before, Mark is not one patient that we have so many. We have 30, 40 more patients who each have come down with a different problem in their immune system. And now they're designing their own experiments to get it better.
The ultimate goal of this was the students stated, the interns put together at the beginning. They wanted to know a year and a half ago, number one, what do we know about the true nature of cancer? This was in 2016.
Yep.
That we're not really thinking about as much as we should. What's really important? And number two, are the cancer-fighting immune system cells, are they intelligent? And how would we measure that? How would we measure this intelligence? And then the final question they had was, what is the quickest way that we could learn how to teach the immune system of normal people to keep it at high intelligence so that you
Yeah.
never develop cancer? This is, again, believing that everybody actually has cancer all the time. And so that was their three original questions. And now, as a result of these many seminars that we'll continue on April the 1st with you folks, we're now up to 15 key questions that we learned from the seminars themselves.
It
And
came up as in the conversation itself. The
Right.
participants asked these questions.
And I think you're going to be shocked. When you see them, it'll
Yep.
shock you.
Yeah. So on the April 1st, the seminar, so you will focus on this unique pattern, the patient-driven research, right? Oh, okay. So what kind of the participant will be best suited for this seminar?
So one of the things that I feel is wonderful about what Ananya has created with her colleagues is another way to think about cancer, a brand new way to think about cancer. So I always think about it as a medical doctor.
Yeah.
I'm always thinking as a clinician.
Yeah.
But maybe she thinks about it as a researcher, or you think about it as a researcher,
Research,
or maybe Mark thinks about it as a patient, or etc. So their idea is very simple, to say, for one moment, for maybe just 2 hours, think about cancer as someone who either has cancer, or
will have cancer.
or maybe you have a loved one with cancer,
Yeah.
or maybe you just don't want to get cancer. Okay?
Okay.
And that's all 300 million Americans. Everybody's in there.
That gets everybody in the picture.
As everybody in the world.
And you'll see in the conference on April the 1st that they become empowered, all the disciplines come together, all the different groups with the expertise that they have, and they have the tools to be there as equals. Everybody's equal. And just for 2 hours. And so Mark and others, or Ananya, a young researcher, they don't come just to listen to old people or people with a lot of degrees.
Yes.
They come in one of those three places to say, how fast could I learn how to make this new approach to cancer work for me, either because I have cancer, because I have someone I loved who's dying from cancer, or because I really, really don't want to get cancer. And that, to me, anyone who can go into that space is an ideal participant. They'll do very, very, very well.
So everyone can go to that.
Everyone.
Yes, in addition to what Steve said, I think it's also really important for us to invite all age categories to our Rethinking the Science of Cancer seminar series. This research method was actually initiated by a group of very young cancer researchers and patients, and during this process we've enjoyed partnering with 80-year-olds, 90-year-olds, and even high school teens. So I really believe that our seminar series should include people who have cancer, people who have loved ones with cancer, and people who simply just don't want to get cancer, regardless of their certificates in the field, their different silos in the field, and regardless of their age.
And so what Ananya is saying, if you have a high school student at home who's passionate about one of those things, they will do very well in this conference. They will come transformed. Mark, do you have any other suggestions about who should come?
I think not only people who have cancer are interested in cancer, but in science in general. You can improve your knowledge by coming to one of these seminars. And you may, by listening to the presentation, come away with a better understanding of the science of cancer, but also you might get someone to be interested in researching cancer. I don't think you should limit it just to people that are interested in cancer. I think there should be, everyone should come.
For the actual patients who already got cancer, how will be useful for this seminar?
Yes. So the number one thing that I ask for my patients, that I tell them how passionate we are as researchers to want to know how to make their cancer go away forever. But maybe if it can't go away forever, that we beat it down into a space where it's very well contained by the immune system, and they don't know they have it. They live a normal life, and then they get to die a long time from now from some other disease. Okay? And in that space, what I tell them is, we want to get into a space of equality as quickly as possible. We want you to know that you are really taking charge of this, because you have no idea how much peace of mind comes when you can wrap your mind around it, when you can actively make choices, and you don't feel like a victim at every stage. So for me, the ability to connect with my patients, like Mark, but all of them to greater or lesser degrees the same. So, and in fact, you're going to hear an extraordinary case on April the 1st of a patient who just really designed his own cure and then offered this material for all of us to learn from. That to me is a very, very different way of connecting with my patients, and it works instantly. Every patient who gets that sense of control and starts to see the people around them as collaborators rather than people telling them what to do.
As equals.
As equals. That's the goal for me. You might think it differently.
I think the immediate benefits and rewards that any participant, especially patients and young researchers, can expect from our seminar are 5 tools that come up very, very early in the seminar series. The first one is the power of asking the right questions. I don't know if you've heard of Jonas Salk or not. He was the person who came up with the polio vaccine.
And our modern flu vaccine.
Oh, okay.
Yep, and he says that the answers that we're looking for pre-exist. They're only waiting for us to ask the right questions. So we really believe that it's really important for us to ask the right questions before we start looking for any answers.
Yes.
The second tool that we give away very, very quickly for people to be really, really powerful in our seminar series is the science of science. And that's exactly what Mark was mentioning.
Yeah.
How science really works in 21st century and how it's changing so rapidly as we learn more and more, specifically about cancer and the true nature of cancer and immune system cells. The third tool that also comes out very clearly is the science of learning. Because our seminar really is designed for participants to learn really, really quickly, and also at the cellular level to see how do cancer cells learn really fast.
And how do immune system cells learn? Again, we're going to be building this picture of a spy versus spy.
Yeah.
And who knows more? And how can we help the immune system get the upper hand?
The fourth tool that comes across very quickly is the science of intelligence. We believe that every cancer cell and every immune system cell has a problem-solving intelligence. Like Steve keeps mentioning, the spy versus spy.
Yeah.
They're always outplaying and outgaming one another. So they have to have some kind of intelligence that is derived from some kind of very, very quick learning ability that they have. And the fifth one is...
The science of health,
Yes.
21st century health.
Yes, the
So-
fifth one is the science of 21st century health.
And that's changing very, very quickly, not just at a policy level. You know now that Trump and others are redoing Obamacare.
Yeah.
That's at a policy level.
Yeah.
But our concept of what do we mean scientifically when we say someone's healthy, we are now gaining a brand new scientific insight into that we did not have in the last century. So those are the 5 tools: power of questions, the
Science of science.
the science of science,
Yep.
the science of intelligence, the science of learning, and our new modern definition of 21st century health. Those are actually very integrated concepts, and the participants will then use them to solve problems. The seminar is very interactive, and so they'll find themselves waking up right in the middle, and then we'll profit from that.
Yes, and well, they will profit from that.
And they will too.
Yeah.
I personally will be really, really heartbroken if these tools don't get out to each one of our participants. I really think that patients and young researchers specifically can carry these tools to each one of their scientific conversations to make brilliant choices for them. So it will be great if they can get it as soon as they can. And as Steve was mentioning before, we want to take the seminar series to as many academic facilities as we can. We want to get this free, integrated, intergenerational message out as soon as possible.
Mark, do you have some suggestions about the benefits that patients will receive?
Well, I think number one is that it will give you hope that you're not by yourself, that you have this array of expertise to help you get through your problem and help you solve your problem. I can't, as I said, I'm really grateful for all the help I've had from you and the rest of the experts at Walter Reed. But I just think that that patients, they can feel like they have a stake in this, that they aren't just some doctor's experiment, that he's going to give them some drug and hope that for the best. That at least the patient will have some say in what the doctor will do and what the patient will take, and hopefully have a successful outcome. You know, I've been really happy that that I've been working with you and the rest of the clinicians at Walter Reed. And it gives you a satisfaction that not only are you helping yourself, but some of the things that you are learning about yourself and that the doctors are learning is being passed on to other patients, and hopefully they won't have to go through the same circumstances that I did, and perhaps maybe they'll have an even better outcome than I got.
Aurora, I think one of the things that, from a patient perspective, that really comes across very quickly as soon as they come to clinic is to be aware of the fact that the entire field of cancer is now changing so fast, like a teeter-totter. It's just shifting so fast.
So fast,
And at the heart of this shift, there's many, but at the very heart of this shift is this idea that for about 100 years, we have been focusing on cancer cells as dangerous cells. And of course they are. And then we've been focusing on ways to eliminate them as quickly as possible. And cancer still is a surgical disease. If you can get a surgeon to cut it out and put it in a bottle, that's good. But from there, all of the thought has been to say, now, what else is going on in there? How many more terrorist cells are there? And how can we bomb them, like carpet bombing ISIS in Iraq? How do we bomb them and get rid of all of these cells? And everything's been focused on these terrorist cells, especially their genetics, the mutations and all of this. And the science has been exciting. We've learned a lot, but it really has not changed outcomes for patients in 100 years.
Yes.
So this is another way to almost, not really, but almost ignore ISIS and ask the question, what is it in the surrounding community that makes these cancer cells possible? And what would these surrounding community cells need to know to reject these terrorist cells? And that's the big dividing line that the patients become aware of very, very quickly. It's really not an aggressive war or a hateful war, but certainly an academic war in cancer today. And who you talk to as a cancer patient about that idea is going to change your life forever.
So speaking of the cancer-free American, where do you think the future of the cancer research or cancer therapy going?
I think the future of cancer research at a clinician level is starting to recognize that that our old model, remember, I don't know if this is working for you, this idea of carpet bombing ISIS, of attacking terrorist cells, that model seems to be disappearing quickly. But also in that model was a very expensive type of science where we do these very, very large trials, phase 1, phase 2, phase 3, coming up with the maximum tolerated dose of an agent, and then maybe putting 3,000 or 4,000 patients into these trials to see if we could get a 10% benefit, 20% benefit, 30% benefit, something like that. I think those days are over. I think with this immune system, because of the things I've just shared with you, one, that our immune system seems to be an extension of our nervous system. Your nervous system, Aurora, is very different than mine, but it knows how to detect entropy, and it knows how to detect the health forces, and it knows how to help you to move effectively to embrace the health forces and move away from entropy. The immune system is doing exactly the same in your body, but for 100 trillion cells looking for threats like this. And it knows how to recognize entropy, and it knows how to find health, and it has the authority to make whatever moves it needs to protect your unique system. It's also very complex, and it's also, I can't believe that all of us have the same type of breakdown every time our immune system breaks down. So we have to learn now from individual patients what are the patterns that make the cancer possible, and identify the things that we can find in their tumor specimens and other things that we look at that could actually predict who's going to be responding to these immunotherapy agents. And there's a growing list of them. And then number 3, We need to learn how to give these agents much, much more intelligently, so we don't create these crippling autoimmune side effects. We're giving these doses, the doses that we have are maximum tolerated doses of these agents, as if they were chemotherapy. But it's not. They're supposed to make a concert go better. You know, like an 1812 concert, timing and intensity, everybody moving. It's supposed to help that move forward. And we're trying to make the whole thing work with massive doses of anti-PD-1 or anti-CTLA-4 or anti-PD-L1 or many others. And we know this is wrong. We need a new model to think about this. And so that's my idea.
So what is the result of this new pattern, the question-driven resolving method?
I'll let Ananya speak to that.
Yeah.
All right, thank you so much. One of the sets of results that we've gained from our Rethinking the Science of Cancer seminar series are these 15 questions. As we have mentioned several times during this conversation, we started with 3 initial questions. What is the true nature of cancer? Are cancer-fighting immune system cells intelligent? And how can we create an intervention to upgrade the intelligence of the immune system cells so that we don't
in normal individuals,
so that they don't become clinical cancer patients. Now these 3 questions have developed into being 15 questions, and each one of the 15 questions actually came up from our participants, which are clinicians, researchers, patients, caregivers, yes, and now business leaders. The other one is that we're now getting ready to publish the results of how much the participants report they've grown during this conversation just in 2 hours. We've given this presentation in several federal agencies, we started at Walter Reed, we've been at the United States Joint Pathology Center, we've been at the FDA, we have presented at the University of Maryland Medical School. We were at Stanford University in January, and now we're getting ready to present at Johns Hopkins, courtesy of SEPA. And during all these conversations, this seminar series, participants report that they grew 60 to 70% in their understanding of how cancer really works, of what the field is now, and what are the new questions that need to be asked now. And just to really emphasize that all the participants that attend our conversation are actually very, very academically accomplished.
Yeah, they have like about on
20
average,
years of education.
Yeah. So they're very brilliant going into the conversation.
Yes.
Right, and the fact that they can report 60 to 70% growth in their understanding of how cancer really works is just mind-blowing. And that motivates our team to be able to take this Rethinking the Science of Cancer seminar series to as many facilities as we can. We want to get this message out as soon as we can to 300 million Americans to make the vision of a cancer-free America come alive.
Yeah.
Because they're so powerful.
Yep.
And
they're not being asked anywhere else. And you're going to see the evidence of that in our conversation. So that's going to be proven very, very quickly.
And so our goal, the whole thing is free. We just want to get it out to as many academic centers across the nation as quickly as possible.
Yeah, I know. You want to bring the cancer to all of the cancer information and the immune system to all of the American.
Exactly.
Yeah, we're really looking forward to your seminar.
Well, thanks for the interview today.
Thank you.
Thank you so much.